Hospitals are buckling under pressure due to the rolling blackouts. While backup systems are in place, they aren't coping with the frequency and length of power cuts. eNCA's Heidi Jokos joins us from the Rahima Musa Mother and Child Hospital. Good morning, Heidi. Just talk us through the challenges or conditions that hospital staff have to contend with.
Yes, I think it's a very worrying picture, Fundo. We do know that blackouts are affecting almost every aspect of our daily lives. Earlier on this morning, we were speaking to JMPD about how they are trying to control traffic. People are spending a lot more time in their cars because the traffic lights are up because of rolling blackouts. But another big and very important aspect is the fact that hospitals are buckling under. They are not coping with the constant blackouts. And because the country has been subjected to stage 6 power cuts, I think it's only going to get worse, and it is getting worse. But I think to get more perspective, we are joined by the MMC for Health and Social Development, Ashley Solzer. First, thank you so much, MMC, for your time. We do appreciate it. And good morning.
Good morning. That's an inside joke between you and I. Good morning,
let's just start off with the dire situation that many hospitals are facing at this stage. We've been at Rahima Mother and Child Hospital before. They've expressed the dire situation of blackouts and how they wish they were excluded from blackouts because they are not coping, and children are actually dying because of this. Just tell us from your understanding as an MMC what the situation is.
Yes, of course, I would be lying if I say that the load shedding scenario is not affecting health negatively, because it is. But we want to take the approach as the administration in the city of Johannesburg to try and be proactive, and because we cannot use any excuse if it's going to affect lives. And so we are committed, we care for the vulnerable that we have to service through our health service. And as a result, we actually visited Rahima Musa, as many knows. And one of the things that was raised was these kind of challenges, especially around their generator having to run for longer than it could, and then it affected the functioning of the generator. And then thereafter, we committed to say that we are going to speak with MMC Sun, and we did. We had that conversation, and we are action-driven. He brought in the MD, and as we speak now, on the 5th of June, the management of Rahima Musa actually on record stated that they are thankful that MMC Sun, myself, and the team has assisted them to overcome some of the challenges. So what happens is every hospital has a generator, and but we have now confirmed that we are able to isolate hospitals, and then if that doesn't happen with hospitals, they have a direct line to us, so they can call MMC Sun's office, or rather the MD's office at City Power directly, and then we try and solve the problem as best we can. But the truth of the matter is that we're sitting with this challenge, but we are proactive because the health of our citizens are, of course, of extreme importance.
That's good news, though, that hospitals now have been basically excluded from the blackouts. I just want to, I know, and it's a good thing that you're speaking about the extensive work that this current administration is doing to try and make sure that the city functions, despite the fact that there's so much reliance and dependence on Eskom. We did speak to MMC Michael Sun last week, and he did say there are plans to get us off the reliance and dependence of Eskom. But I want you to be brutally honest. I want you to speak about the realities that these hospitals, doctors, nurses face on a daily basis. We do know, for example, at Charlotte Maxeke, it's a mess there as well. And by the time generators kick in, you have doctors using their cell phone torches because the generator's taking a while to kick in. Petrol's going up. There's huge costs when it comes to keeping generators up and running. Be honest with us. Is the reality really that bad, and are people dying because of these blackouts?
Our position is truth and transparency, and as I'm sure everybody knows already, that that's my stance. So it is true. Hospitals are affected, our doctors, our nurses are working under tremendous pressure. And of course the recent headlines around Dr. Tim de Meyer, for example, who is still being victimized, and yet he should be considered a hero. And I came out publicly saying that it's time that we celebrate doctors who, under this trying times and circumstances, are coming out and they are doing the best they can under the circumstances. And we should stop victimizing such and give royal treatment to those that are responsible for what is happening at our hospitals, poor maintenance, etc. And so, Heidi, I'm the first to admit the situation is bad. But we are not going to make excuses. I'm not going to stand here and say we inherited this, because in inheritance you can't choose. But if you inherited something, it is yours. This problem in the health sector in the city of Johannesburg is mine. And I've got to be proactive, and that's what we're trying to do.
I'm sure, just lastly, you will welcome the fact that the MMC, Michael Son, is trying to make plans and expedite the process to get us off the dependence of Eskom, because that will surely solve a lot of problems and save lives.
100%. And so we should celebrate the work that is being done under the circumstances. It's not going to change overnight. It's not easy. It's very difficult for MMC's son, his team, for myself, my team. But we're working extremely hard because the truth of the matter is we care.
Great. Okay. Thank you so much for your time. We do appreciate it. And I think just giving a raw account of what truly goes on here, that's the MMC for Health and Social Development in the city of Johannesburg, Ashley Souls the first. And I think, Mfundo, sometimes we just forget about the impact that blackouts have on a daily basis and how devastating it is. And, having been in this hospital when the Human Rights Commission was here and hearing doctors say, we can't save lives because of load shedding. It's horrible. And we just hope that the powers that be understand the magnitude of constant rolling blackouts and how it's affecting absolutely everything. And people are dying. Children are dying.
Something needs to be done about these blackouts, and most certainly there needs to be a level of appreciation, especially with such reports from Eskom, exactly how significant an impact they have on our lives if we're constantly seeing these blackouts. Heidi, thank you very much for that update. That's Heidi Jokos there for us. Now, rolling